So now I want to invite Dr. Wang from Singapore, not Singapore, from Chiangmai, sorry. And he is now our distributor for China, and thanks to him, we really get a foot into the market, even so there's still, of course, a lot to be translated, but he has some first experience with the system, that some feedback, and I want him to talk a little bit about this. So.
Thank you. Good morning. I was a graduate from the Western Medicine School. I feel a little bit nervous because I'm not very good oral English. So,
I don't know.
And after graduation, I feel I'd be a doctor, can cure all kinds of disease. That's what's my life aim. But actually, I can cure nothing but one disease. It's common cold. It's no use to cure the well recovery themselves. So I tried many modality of the medicine. So Chinese TCM and muscular disease, and in Germany have the natural classical medicine, and even in Hong Kong and Singapore to learn the feng shui. Geographic energy will influence the people's energy, cause the disease. And now in the information medicine. So we try to find out a real way to solve the patient's problem. Now I really know the truth of we can use in the clinic. Usually we all focus on the physical level, not in the metabolism level, and not even in the energetical level and the information level. So now by the use of a tool from the CoRe and Chiangmai, totally 4 levels can working together to solve the health problem. So mostly the core of the cause, the core cause of the disease may established in the information level. By chance, I learned some medicine called medicine a couple of months ago in China. It's a doctor come from Denmark. And now thanks to the Sonia, she told me it's a new German medicine.
German. Of course.
So it's an emotion cause the disease. And you will find some information inside because of your life insurance. Maybe you will come by some traffic accident, or you're rapid in your very young age, or you have something unhappy happen events in your life. But will create a bad information that may be the cause of the disease. And firstly will cause you the imbalance your emotion. Then physically will develop a disease. So that's quite simple for me. Now I use the CoRe to balance the information problem. Then use the BBR to balance the emotion problem. Then use the detox program and some part from the Aaron, then to the detox. So totally working together have a very, very good effects. So some patients with cancer, even metabolism through the brain. Breast cancer, one patient, a female, aged 42, have the breast cancer. 1.5 years ago, have the operation and chemotherapy and radiation, now develop, mathematic to the her brain. 5 lesions, but just 2 months, all the lesion in her brain has gone. So this really shocked the doctors still working in the Western medicine field. So now and more cancer people, they are recovering. Very short time, even just 2 sections, 1 section 7 days, 2 sections, they all then the cancer will disappear. For instance, 68 women have the virus B hepatitis infection 20 years ago. Then, 20 years later, she developed a sclerosis of liver. Then, finally developed a tumor, 3 tumors in her liver. But now, just 2 sections. All the liver cancer gone. So, that's what I want to say. Marvelous courses in the BBR. And yeah, thank you so much for hearing.
Thank you. And so you are a doctor and from what background?
Neurologist, have the Western medicine 5 years education in the Second Military Medical University in Shanghai.
And we met first time in Hong Kong, huh?
Yeah.
Yeah. So so you use it until now personally, or you just supervise? I mean, you are doing the training also for new people that buy it, yes. But you also use it personally in your clinic, yes?
Yeah.
So thank you.
I have 3 sets of this system.
In your clinic?
Yeah.
Let's see. So how much? This is how little I know. Thank you very much. Thank you. Now I want to invite
Dr. Wang.
Wang, and
you know, I'm a TCM doctor, but I was learning the master degree in the Second Medical University in Shanghai. So I was a colleague of Dr. Yu in the same hospital. So we are really good friends. I got information from Dr. Yu, and he always tell me some amazing techniques. But at the beginning, I always suspect, is it true? Maybe something, you know, is a trap, right? Because for some years ago, I bought a machine. Also, Dr. Yu introduced it to me for like 3D machine, you know, from Taiwan, but that's really terrible for me. So I always suspect, did it work or not? So I used the BBR over, you know, 6 months. So at the beginning, it's not really success. Maybe I think, oh, it's another trick for me. So afterwards, I always call Dr. Yu, give me some advice. You know, even I send email to Sonia, I want to know more about this information. So actually, you know, since 1994, I learned information medicine in Shanghai. But you know, in 1990s, at that time in China, what is popular? The Qigong, not Falun Gong, okay? The Qigong is very popular. So I knew a professor, he's a physics scientist, did research on this energy, but they think it's information. So they test, it's some kind of lower frequency energy, but they won't use it in clinical, then they do some tests, and they enlarge the signal. For example, right now only 1 watt, then see the stronger the better, then they enlarge to 10 watt to radiate on body, but it didn't work. Didn't work at all. But the low frequency, it really worked for the liver, but only for some, you know, mild case or, you know, slight case, not for severe case. So they didn't know. But now I know. I can give them answer because he already told us all the background, as Marco said as well. You know, they have to know the emotion, all the background, not only this is virus or this is some like bacteria inside. We have to know all the background, all the emotion. So 20 years ago, when I met this machine, they never mentioned, oh, related to our heart, related to our mind and soul, right? They only feel like a Western medicine, focus on the what? On the corpse, on the visible things. This is a Western idea, totally Western idea. So afterwards, I met other, you know, Dao practitioner master. He has a tube. Maybe someday I can show the picture. Dr. Yu knows. So this one, we got great result as well. But this machine, only we can use for 1 or 2 years, not like BBR, whatever. That if we have the electricity, we still can use, right? For our machine, this Qi information machine, this master used his energy to a small pills. So at the beginning, I also suspect, oh my God, it can work or not, but it really worked. But we have to use maybe 10 or 12 machines at 1 second, 1 time to this patient. Not like this one, it's so simple to use. So since 3 months ago, I know the background, start to understand something. I start to treat, one early stage of cervix cancer in the uterus. After 2 months, totally gone. Totally gone. I use some very simple herbs to take orally as an excuse. Otherwise, only the machine maybe disrespect. Oh, maybe you cheat me, right? We need to give some kind of pretext. Oh, they need these pills and they need the machine. So, but unfortunately, this lady listened to the Western medical doctor, listened to the surgeon, the gynecological doctor. He said, maybe this doctor cheat you. Me, I cheat him, her. And they still take surgery, but by the biopsy, what happened? Nothing at all. Nothing at all. Then she's crying, but the milk already, on the ground. So the second case, I treat left lobe cancer in the lung. Also, before I came to Shanghai, we did this test. All the blood tests shows close to normal, and the CT shows it's really smaller, only 2 months. But I didn't do like Dr. Yu every day. I do only 2 or 3 sessions a week. You see, after 2 months, this is a really severe case. But you didn't get any chemotherapy, no surgery, no radiation, only with our simple herbs and the BBR. And also, I have 2 other cases, very interesting. Those 2 cases has been treated in America, in our hospital. Our hospital, Renning Hospital, is one of the biggest hospital, Western Comprehensive Hospital in Shanghai or in China. So, the dermatology professor gave them the diagnosis, Sjorn syndrome. Sjorn, no tears, no salivation. The fluid is really little. They need, artificial tears to the eyes, right? So after I treat them, maybe only several months, the IgE, immunoglobulin E, the first time over 10 years is normal. But before, he always take cortisone. No, now I told them to stop cortisone, no more. And the morning stiffness, back pain, one time by one time, it's much, much better. No complaint at all. So I think BBI is not only the energy, give them the background. If we, for the therapist, for us, so for the medical doctor, if we can explain them very clearly, for the disorder, not only the serious disorder, your heart, your mind, your family. If we can explain to them, they might accept it. If they accept it, at 1 second, they already, even without BBR, they already feel calmed down. By the BBR, this is a tool, maybe some other information will transmit to their body. They will get the result immediately, especially for pain, maybe, although for insomnia, for us, maybe only 1 or 2 sessions, done. Over 10 years, over 5 years, they never feel good sleep. At 1 session, next day they can call us, "It's really great, what did you use?" Nothing I can feel, But for my experience, Dr. Yu ever gave me a test. At the first session, my whole socks are wet. So combined with Chinese medicine, it is really great because in East, especially in Bangkok, or in Thailand, Bangkok, or near the sea in China, too much humidity. Too much humidity. Depending on TCM, traditional Chinese medicine, humidity is one of the most important reason for the tumor or cancer. But Western medicine, they only cut it. They never know. We have to change their constitution, their character. So this machine gives us a great idea. How can we relieve this humidity? Because humidity is really sticky, It's fixed in our body. We can't, really clear it out easily. If you know the Chinese medicine, there are 6 factors like wind, hot, cold. Humidity is really difficult to clean out. So by this machine, it's quite excellent techniques. We can use it to clean them easily. So second idea for myself, with this techniques, you know, in printer, right? Printer. This one gives us the great idea, target. Otherwise, they never, because the patient needs to know, I have to improve the here, not here, right? I have main complaint here. So, because combined with our TCM meridian idea, the meridian, right? We have some herbs or plants really work on this meridian, on that meridian. So I figure out the techniques, some kind of special plants that is energy or information to work on that area. What do they use?
Right.
So this one is very excellent. Before I always want to figure out the techniques. How can we focus this area? The modern techniques is target techniques. But now it's easier, right? We can direct this energy or information to this area, that area very easily, you know. So up to now, this is my whole experience.
Thank you.
Maybe it can help you.
Thank you. And one moment, because you gave very important pointers. Like he said that it is, for example, in cortisone. Cortisone is what it's an immune overreaction.
Yeah.
So, and I can say the laser will have the best results in everything that's related in some way or another to immune system.
Yeah.
Allergies, even like AIDS, and then emotional is there's of course also an immune system. For example, autism is an overreaction of the emotional immune system. Why the immune system? Because this is giving you more security about yourself.
Yeah.
And this is what, I mean, when do people get wet feet? When they're standing in front of a lot of people. It's another immune reaction, yes? So everywhere where you look, you have those overreaction or underreaction of the immune system, and you will see good results there. And then the other idea you gave, and this is something else I know is very important, to use herbs and also physiotherapy and also nutritional changes, because information can only give the impulse, the direction.
Yeah.
But let's say the computer, how much can it do to move you from this place to that place? Nothing. But you need a computer to guide an airplane how to go and where to go. And this is what they call it, it's the computer, it's the mind behind actions. So now when you have an herb that you know is good for this kind of symptom, then I think it's a wonderful idea to imprint the information where should this action occur. Because this is exactly like a GPS. My idea is to create a GPS
Yes.
for the health and for the emotions.
Yeah.
So thank you very much. Thank you.
Yeah.